Welcome to Zara Asif, who joined the Centre for Society and Mental Health at King's College London in 2021. Her research focuses around global mental health and mental health, particularly amongst marginalised communities such as ethnic minorities, refugees and migrants. And in addition, she's worked as a co-PI for the Not My Shame project, which focused on creative collaboration between researchers and artists and emphasised on the empowerment of survivors of violence and abuse. I'd also like to introduce Rhea Sookdeosingh, who is the public engagement lead for the Shame project at Birkbeck. She's an experienced public engagement practitioner and has previously worked in capacity building roles here and at Oxford. She particularly works to develop and steward partnerships that drive humanities-led research and innovation, and she has an overarching interest in showcasing the social and civic value of the arts and humanities research and practice.
Thank you so much, Sarah, for introducing us and for giving Zara and I the opportunity to have this conversation, and thank you to everyone joining us. Just as a quick reminder, we are recording this, so if you wanted to turn off your video for the discussion part, that would be great, and then you can come back in during the chat if you'd like to. So Zara and I are going to chat for about the next 30 minutes about our experiences of creating inclusive public engagement programs with survivors of sexual violence. And we'll just start with each talking a little bit about the projects we work on and our overall approach, and then we'll go through a few of the sort of like main areas that we think about in doing this work, and then we'll open up for discussion. So to begin with, I'll hand over to you, Zara, if you want to tell us a little bit about your work on the Not My Shame project and your approach to public engagement.
Thank you, Rhea, and thank you, Sarah, for the introduction. So I was a co-PI with another colleague on the Not My Shame project, and the project essentially aimed to support survivors by shifting their beliefs and feelings of shame through creative writing. We focused our project on Black LGBTQ plus women survivors, as we found that there is little support targeting them and they may experience additional marginalization when seeking support. So how the project worked was that we worked in a couple teams. We worked directly with our collaborators, which was a women's only charity based in Islington. They're called the Maya Centre. I'm sure some people are aware of them. And then we also work with Rhea and Leanne, who is a lived experience expert who designed and facilitated and led all the workshops. And then also we worked with Evie and Zoe from Sweet Thang Zine, who worked together to produce this beautiful zine at the end, which I'm sure either Sarah or Rhea will be able to share either following the conversation or at some point. So we ran self-care focused creative writing workshops, which participants attended once a week for 6 weeks. And Andrina gave them writing prompts and encouraged them to write anything they wanted and in any style. The inclusion criteria was that there is no experience needed when it comes to creative writing of any sort. There was no experience needed because we had a couple of queries come in when we were recruiting, asking or saying that they've never written before, or they don't have any experience. So we advertised it as that. The participants could share as much or as little of their writing as they wanted to, but were encouraged to discuss what they had written in the group. So as well as the facilitator, like I mentioned, Andrina, we also had a therapist present at all times during the 6 workshops, and that was provided by the Maya Centre. And the point of the therapist being there was so they could offer support when needed, especially when discussing topics to do with violence against women and shame. And then after the workshops were completed, some of the poetry that was written by the survivors was included in a zine, which was developed by Zoe Thompson from Sweet Thang Zine. And then myself and my colleague, we put together a public engagement event at the Science Gallery, London, where the zine was showcased. And this was a bit surprising because we had no expectation of the survivors reading out their poetry, but all of them opted to do that, and they shared it with the attendees, which it was an amazing evening. And yeah, I'm not sure what else. That's kind of the overview of the project, and I'm sure I'll talk more about it as the questions come in and as we discuss further. But I think that's it for me in terms of what the project consisted of.
Thanks so much, Zara. So great to hear about. And yeah, I think we'll dig into a lot of that as the discussion goes on. So on my side, as Sarah said, I'm the public engagement lead for the SHAME project, which stands for Sexual Harms and Medical Encounters. And we're based at Birkbeck in the School of Historical Studies, but we are an interdisciplinary research group that looks at the medical and psychiatric aspects of sexual violence from a global perspective. We're funded by the Wellcome Trust. We started in 2018, and the grant is ending next month, which is like unbelievable and so sad. But I think it makes this a great opportunity to sort of reflect on the work that we've done for the past 5.5 years, working with survivors and with other partners. And that's ranged from like one-off events like book launches to more sustained programs of engagement. So for instance, we had a writer in residence program with the author and activist Winnie M. Lee that featured both closed creative writing workshops with academics, survivors, and activists, as well as public events on like sexual violence in the criminal justice system, an event with other authors about how to write lived experience. We've also had creative writing workshops on military sexual trauma, where we had an academic, a retired lieutenant colonel, and a therapist who specializes in military sexual trauma work with a group of serving and retired service women. We've collaborated with a documentary filmmaker called Sophie McCorquodale and 4 survivors of sexual violence who sort of talked about their journeys of navigating the aftermaths of sexual violence and their calls for more like inclusive practices in support services. And our big collaboration was with the gender equality charity, the WOW Foundation, who we worked together with to create something called the Shameless Festival of Activism Against Sexual Violence, which is a festival model that brings together survivors, activists, academics, artists, practitioners in a mixed program of talks, performances, interactive creative workshops, how-to clinics, a marketplace, and support services in order to create a shared space for people to come together and really challenge the stigma around sexual violence and to collectively work together to imagine and action a rape-free future. And the first Shameless Festival took place in London at the Battersea Arts Centre in November of 2021. And the second festival took place in Brazil, in Rio de Janeiro, in September 2022. And for all of these initiatives, whether one-off ones or longer programs, our approach has really been a survivor-centered one. Public engagement really emphasizes and requires you to take a research-led approach. And of course, our research informs the work we do. It's a big part of it. But we've found that actually what really matters is taking a survivor-led approach. And I think this matters for a lot of reasons. One is because universities were still really not there in terms of being able to make properly equitable partnerships. So in light of that, setting the tone really early on makes a difference. Setting the tone that not only are we not going to be like extractive and exploitative, but also we're not approaching this in terms of like directing, like being directive and saying, this is what we want to deliver, this is what we want to do, and you can kind of come in and help us do that. No, we really lean the other way and have the people we work with lead in terms of sort of setting the framework and the rationale and the parameters for what we do, leading on who else we include in terms of like participants, other speakers, what audiences we want to engage with, leading on ethics and safeguarding. And of course, we also pay all of the people we work with. And this is challenging, challenging in the sense that it creates sort of extra work and often like emotionally demanding work, because working in this way sort of goes against sort of like orthodox and usual practices within universities. So we're sort of like circumventing the usual way of doing things. And I think it can definitely push people out of their comfort zones. But it's so worth it in terms of creating really high quality events and projects, and ones that really make a difference to people. I think in university, there can be cynicism, and rightly so, around the impact agenda. And it can be really narrowly defined, like how you measure impacts. But what we found is working in this way and creating spaces where everyone can bring their whole selves and their whole perspective to the conversation really makes a difference in people's lives, in terms of allowing them to either maybe like disclose themselves and seek out support, find support with other peers, create avenues for their own advocacy and activism, and for the partners that we work with, network in ways that enables them to take this important work forward in terms of trying to make change in policy and practice. And then, of course, for the academics in our group, it's also been really meaningful in terms of shifting people's perspective, really deepening their approach to their research. So it's all been, really worthwhile. And I know we'll get into a lot of this as we go on. So I'll hand back to Zara. You did touch on this in your introduction, but sort of your approach to inclusion and recruitment, and the decision to sort of actively and explicitly recruit particular demographics of survivors. So did you want to talk a little bit more about like how you came to that decision and how it worked?
Yeah, so as I mentioned before, our project focused on Black LGBTQ plus women survivors of sexual violence or gender-based violence. And when we so the project was funded by the Violence, Abuse and Mental Health Network at King's. And when the funding was approved, we didn't really have a very specific inclusion criteria for when we will be recruiting survivors. But then we had a meeting with the Maya Centre and Andrina, the facilitator, and then also Zoe. And after discussing, because they were going to be small group workshops, it was a general agreement that we, of course, want to make it as much of a safe space as possible. And then based on that, we came up with a very specific recruitment criteria. And we had a lot of interest. And the way that we recruited was that, again, recruitment was done. I should have mentioned this before, but the way the project worked was, as co-PIs, we're actually very hands-off. And the Maya Centre were the main coordinators when it came to the project. So they were basically doing all of the recruitment, all the safeguarding and everything. And we were very much the admin coordination people and supporting in whatever way they wanted us to support. And when they were recruiting, they did initial interviews with the therapist just to make sure that the participants were able to take part in the study. And then the project. And then at the end of the project, during the debrief session, general consensus by all the survivors was that they felt that because the recruitment criteria or the inclusion criteria was so specific, they felt very safe and open to talk about the topics related to shame that they talked about during the 6 workshops. So yeah, that's kind of, that was the thought process behind how we chose the inclusion criteria when it came to it. And I think based on the feedback, it worked quite well. Especially, as I mentioned before, this particular group of survivors, they're likely to experience more marginalization based on research when trying to access support as well. So it was almost an outlet and a safe space that they were able to express themselves through creative writing.
Before I go on to mine, that's really fascinating. I wanted to ask, Yeah, because it's so important to create these spaces where people can feel comfortable to share their experiences and where you're removing as many barriers as possible to allow that to happen. Did you receive any pushback at all at any point in the process in terms of being really explicit about your recruitment criteria, or was it a more sort of supportive process like outside of your direct group?
To be honest, there wasn't much pushback when it came to it. Like I said, we were very hands off when it came to recruitment as well, because it made sense to let the actual experts take lead on this. So when there was loads of interest, I think we had, to be honest, I can't remember the number. I don't want to make it up, but we had a lot of interest when it came to recruiting. And at the end of it, we had 5 survivors in total, because it really was small group exits, and then kind of fed into it being a safe and inclusive space. But no, I think it went really well, and it really helped have that additional step in recruitment of actually speaking to people who have expressed interest, to just make sure that they are okay with the study aims, and not study again, it's like project aims, the workshop aims and structure, and what will potentially be discussed, and just the kind of environment that we're trying to create. I don't think there was much pushback. I think it was a long process recruiting, because you obviously have to be careful, but I think everyone was pretty supportive of it.
That's really good to know. And you can really hear in the way you talk about it that like so much care went into the process. And I think that makes such a difference, as you say. Like you can really see it at the end point in terms of how people experience taking part in the project and what they took away from it. And I think the thing that I'll pick out there that's similar to the way we work is this idea of like relying on partners. And I think that's really important. And I think that is, it's really like a part of public engagement. So I think sometimes, especially with topics like sexual violence, there can be worries about doing public engagement in terms of like, are we going to do it right? Are we going to do it in a way that supports the people we're working with, that doesn't cause any further harm, that doesn't exploit them? How are we going to reach them? And also just the practical things of this isn't necessarily people's area of expertise as researchers. So there's like a real commitment to want to work with survivors and to work with them well. But like, how do you do it? And I think for me, I sort of took that as an opportunity to lean into like re-emphasizing with the people I worked with, that's what public engagement is, that we don't have to have all the answers. We can rely on our partners to bring their knowledge and their expertise. And I think that's really important in terms of creating inclusive projects. It's hopefully not a super controversial thing to say that like universities and academia, like we're not really there yet, I think, in terms of being inclusive cultures and inclusive workforces. And so that being the case, I think the idea that we could sort of solely remedy that on our own is probably like not going to work. And so what I found with working with partners, whether on like sort of smaller events or larger projects, is that leaning on people's networks and their expertise really brings in an inclusive and diverse group in a way that I don't think that we could do on our own, and in a way that really shows at the end point. So I think like, probably not in this group. There's probably a little bit of like echo chamber and preaching to the converted, but there can be a lot of pushback, I think, about being explicitly committed to doing inclusive work and to engaging diverse audiences. But I think it's so important in terms of bringing in different perspectives. And I also think in terms of just quality. So I find the sort of inverse. If I see a project where everyone sort of looks the same and sees the same, I kind of, I question it, like, how great could this really be? Conversely, for instance, with the Shameless Festival, the curation was led by the WOW team. And they did an absolutely amazing job with the programming, like making a diverse program in really like the most holistic, organic, authentic way. And it showed in the end product. Like range of perspectives, the range of topics. It just sort of touched everything. It was so beautifully done and was so meaningful for everyone involved. So I think really leaning on partners is important in terms of the expertise they bring to sort of curating audiences and curating programs, and also in terms of their network. So again, like, we're really meant to be research led with public engagement, and that's so important. And we want people to want to engage with our research, and we want to learn from them. But I think a lot of the draw actually comes from partners and working with people who have visibility already in survivor communities, have credibility and are trustworthy, so that when people come, even if it's not, super interactive, like creative writing workshops, maybe it's being an audience member at a talk or at a performance, people kind of know already what to expect, and they know they're coming into a safe space because they can see, they can kind of see themselves in the speakers in general, or specifically with people they know already. That kind of like credibility and trust is built in already. So I think I don't think any of our projects had explicit recruitment criteria, but I think we've taken a similar approach in terms of really leaning on partners to do that work and being really committed to having as inclusive a program as possible. And I think that dovetails nicely into ethics and safeguarding. So I think you sort of mentioned that the Maya Center, in addition to doing the recruitment, also kind of led on the safeguarding. But I know you mentioned that there was a therapist involved. And so I wonder, if you wanted to say a bit more about like how you approached ethics. Like, for instance, did you do an ethics approval process at King's, even though it wasn't research, it was public engagement? So how did you sort of approach and think about what support system to put in place for your participants?
Yeah, I think the point that you mentioned about credibility and trust, I think that's quite important. And I think in traditional academia, we're so used to and focused on research. So we were very careful, and this is why I keep flipping between research and project, but we were very careful about not calling it research because we were not collecting any data. And when it comes to survivor-led research or public engagement projects, I think there is a lot of distrust when it comes to research projects because it's that thing of, and I hope it's okay to say this, it is sometimes this thing of doing research, collecting data, and then going back, and then outputs take so long to generate that people who were involved in the project are kind of like, well, we never heard back from you. I'm not saying that that's the case for all projects, but I think even personally, some projects that I've been part of, especially long-term ones, it can take a while to have outputs, and then it almost feels like you lose that relationship that you have spent so much time building with the people that you are working with. So I think there's that. And then with that, ethics was quite interesting because we weren't sure if we needed ethics for this project, because I think our argument was that we are not collecting any data. Myself and my colleague, we were only present at the debrief session. We weren't present at any of the workshops. So we really were detached when it came to involvement to the project. It was very much coordination. And then, of course, like once the workshops were done, we were a bit more involved when it came to putting the event together. But then we were in touch with the ethics team at King's, and they suggested doing a minimal risk ethics form. But there was a lot of back and forth because I think it was really confusing, maybe, because it is a one-of-a-kind project for the ethics review team to understand why this wouldn't be a high-risk project. And we kind of had to explain in detail that we aren't collecting any research. To be honest, the only output of it so far would be not even an output, it's more like a public engagement event where the zine is being showcased. And yeah, so it was a lot of back and forth about convincing them that it's not a high risk project, that we have, and as part of safeguarding, we had our therapist provided by the Maya Centre present at all times, just to make sure that we are covering all grounds. And also a massive part of it was the partner that we're working with, the Maya Centre, because they are experts in this field. They work with women survivors day in, day out, so they know what they are doing. And the point of working with them was that they will take lead on this, and they will build trust with the survivors, and they will help create the safe space. So we eventually clarified all of this with ethics, and yeah, there wasn't any ethical approval needed, but we did have an ethics application in place just in case a problem was to arise, or at any point, even with the funders asking us, oh, there was no ethics. So it was more so to cover our grounds, but we made it very clear in the ethics application that this isn't a research project. And the emphasis on that, like I said, was because we wanted to build trust with the survivors, that we aren't taking from this. It's more so a space for them to express themselves through creative writing.
That's really fascinating. Thanks so much for sharing that. Yeah, I think there are a lot of parallels actually, and something you mentioned made me think about this a bit differently. So we have done ethics approval. I think it started with our writer in residence program with Winnie Lee, and then we extended it to Shameless. And that was really interesting because, yeah, typically like you wouldn't technically need ethics approval for public engagement because it's not research, you're not collecting data. But I think because it's such a sensitive subject and the stakes are so high and you're working with survivors, we did do it. And we really benefited from, I have to give all credit to Sarah Marks, who was like really hands-on and generous with her time and working with us to sort of take an ethics approval process that is designed for research and sort of translate what we were doing, as you said, to, I mean, even just the work of in the form continually reiterating, like, we're not collecting data, it's not a research project, but also speaking to the ethics considerations that the committee would want to see. Like even that work creates an extra layer. But it was really good in the end. And I think it would be great, actually. I know it varies a lot, but I think this is being done at more and more universities where people are doing ethics approval processes for public engagement, and they kind of want to, like, there's a sort of desire from researchers and public engagement professionals to have that support, to feel like if we're going out and doing this work that we're doing it well and we're doing right by the people we work with. But I hadn't considered, actually thinking about it, that I thought about the side of the work of, reiterating this isn't research, we're not collecting data, to the ethics committee, but also that if you've spent time with the survivors you're working with closely, or even like audience members at a larger thing like a festival, sending the messaging that this isn't research, it's not like a university event happening at a university, to then have people fill out, read the ethics sheets, which are structured in a very academic way. I hadn't really considered that, actually, after all that work, that maybe then when participants get this form that has the same structure, lays out, this is who this is funded by, this is who we're doing, this is how your data will be, as in terms of your data, just like contact details will be kept. Even that kind of then sends the message of research study in its format and structure, even if what you're saying is it's not research. So hopefully it's the beginning, I think, of a path of all of us working on a kind of parallel, like, ethics approval process for projects like this. And then I was going to say quickly about safeguarding, was to come back to what we were talking about with leaning on partners. So this is another area where we really worked closely. I'll use the example of Shameless, worked really closely with that team who had a lot of experience with creating sort of safe, supportive places to have really challenging conversations. Had a lot of experience doing this, but even they hadn't done it specifically around sexual violence. So we ended up for Shameless saying, okay, well, we're bringing both of our experience and expertise to this. Wow, their experience running festivals, shame, research we've done in terms of, what support people need, but we find this is still lacking. So we worked then with another agency, the Survivors Trust, and did bespoke safeguarding training. And so the end result of that was that for Shameless, we created this whole suite of safeguarding support that went from really light touch reminders in any session that you can leave and take a break. That's completely fine. You can come back. You can not come back. To then having sort of separate spaces where people could go away to take a breather, to having a stand in the marketplace where Survivors Trust therapists were if people just wanted to see what resources were available. But we also had therapists on hand if people needed it. And there was also a healing circle in the event programming. So sort of a whole suite of things depending on what different people would need on any different day, I think. And we've carried that, I think, into other things we've done, this idea that it's so obvious, but they're saying survivors aren't a monolith and people are going to react differently. And even the same person is going to react differently in a different situation. So having a whole suite of support available, I think really matters. And I think it's about having this balance between respecting the autonomy of the people we work with. So not imposing, these are the safeguards we're going to have in place. These are the support systems we're going to have in place because universities are risk averse. But also not going the complete other way and saying, well, it's your call. What do you need us to have in place? We try to find the balance between having the scaffolding in place while also respecting that individual survivors we work with may want to do things differently. They may want supports in place that we haven't thought of before. There may be supports we've had in place that they say, no, actually, I don't think this is going to work for our particular project or our particular event. And so I think, again, just sort of working with partners in a really open and flexible way and allowing the flexibility to shift based on who you're working with and what kind of event you're doing, while also having that scaffolding in place that's holding everyone up, including, the research team, is so important. So I will transition to the last thing. So I know we're running low on time, and this one is a sort of banal topic, but I think it actually is really important for all the things we've talked about. So, all of the work and the thought that goes into wanting to work with people really inclusively, really generously, in a way that respects their autonomy and their expertise. That's work that we're doing as researchers, as public engagement professionals, but we're also working within a very specific institutional environment. So, I wondered if you had any thoughts about were there things in this process where you had to work through university systems that, just made things really difficult? And if so, did you find a way through?
So this is always an interesting one. It's coming up more and more, I find, in discussions. There's definitely, so when it came to this project, survivors were paid for the workshops. That was part of it. And I don't know if this is because I wouldn't even say this is relatively new research, but I do think that it's new in the sense of becoming more common to do this type of not research, these types of projects. So public engagement projects or survivor-led projects. And I don't know if that has yet translated into university processes, especially when it comes to whether that's internal processes or protocols when it comes to payments. I think at the institution that I work with, they have their own process that they go through. They're very specific. They are very time consuming when it comes to on part of admin, because at one time there could be 3 different people filling out 4 different sets of forms and approving them as you go along. And you have to wait for one person to fill it out and the other person to approve it, and then for the other person to approve it so you can do amendments. And then it takes time to then hear back from the payment teams. And even when it comes to so we had a proper MOU and contract when it came to the Maya Centre because they were our direct partners. And even that took some time, and that can, I think it does two things. Firstly, it delays projects, which is a big thing. So the Not My Shame project was a very short-term project, and we had to get so much done in the space of 6 months, and that included workshops as well as the public engagement event and then the final report and everything. So it really delays projects. I think it's also really frustrating on part of the person handling the financial bits and the payments as like the coordinator or admin person that is based at the institute, because the partner organizations might think that the delay is because of my fault. And I think that's really frustrating when you are doing everything possible and you've done everything possible and you're simply just waiting for payroll to process it or like look over it or like let you know if something needs to change or whatever it is, especially when the hard part, which is getting the funding, has been done. But also on the other side, when it comes to survivor-led research, these are vulnerable populations, and they've signed up to these workshops expecting a payment. It was part of the recruitment process. It was on the recruitment poster. It's been very clear. And then having to go through these processes and then waiting on weekly payments or like the payments at the end of it, especially when some of them, might only be able to get out of their houses for this workshop or might not have time or might not have the money to pay for travel or whatever it is. So the weekly payment is to help them out with that as well. And delays with that, I think, can contribute to further distress, especially when you have been looking forward to taking part in something and you've signed up for something only for it to be affected by delays to do with payments and really complicated processes. And it's really frustrating on part of the researchers as well, or the people based at the institution who are running the project as well, because there is really nothing that you can do to speed up the process as of right now. In our case, we had one participant drop out because of it, because they weren't able to pay for travel and they were just getting really frustrated for a good reason. So yeah, I think there's definitely some cons to it, but hopefully institutions can work towards making sure that payments are not a barrier or processes are not a barrier when it comes to public engagement projects.
Yeah, completely. And I think you touch on something important there, which is, they're the sort of frustrations of working through the process, but it isn't just, these aren't just kind of like banal admin things. It can really have a harmful impact on the people we're working with. And this isn't the perfect way to say this, because like vulnerable can be a really, reductive term, but really that's what we're talking about, that people have, vulnerabilities, maybe multiple vulnerabilities. And, you spend year one, asking people to participate, asking them to participate on the grounds that this will be, a kind of supported space. And you've built these relationships of trust, and this can all be scuppered, I think, like not completely, but can be damaged by processes that aren't meant for this. And I think in some ways there isn't a way around it, in that there are processes that have to be in place, and it's not really just about universities. It's about complying with like HMRC regulations, or considering auditing from funders, this kind of thing. But I think what could be done better, and I hate to be hierarchical, but I am going to be hierarchical here, is I think there has to be like a high level sort of strategic commitment to operationalizing the commitment to work with external populations, because I think, there is a big agenda driver around public engagement, civic engagement, working with people with lived experience, and sometimes that's cynical. But I also think most people are really committed to the value and the importance of doing this work, and I think that's there and that's really solid. But the people driving that aren't necessarily in conversation with senior leaders in finance and procurement. And so they're not conscious of, well, actually, if we need to do this work, this is what the nuts and bolts of it looks like. This is what it looks like to try to pay participants. This is what it looks like to go through a contracting process with a small NGO, with a small charity, with someone who's working freelance, who can't afford to outlay all these costs up front and then have payments delayed. So in a way, I think all of this stuff is entrenched, but I also don't think it should be that difficult to change it with an awareness that this is what's happening, and it's happening, sometimes in our own teams or in our own universities. We feel like, oh gosh, am I the only one going through this? But actually, researchers and professional services staff and public engagement staff are experiencing this across institutions, and everyone is kind of locally negotiating their own relationships with teams within their universities to sort of make things better and make these changes. But I hope that we can start to do it at a higher level. And I know that at least some research councils are aware of this, and they are sort of working towards setting ethics guidelines in terms of the theoretical and conceptual approach to ethics, but also around these really practical things about how do we pay participants, not just the commitment, the moral commitment to pay participants, but the actual practicalities of how do we do this. Well, I think I'll end there because we're at 1:45, and I'll hand back to Sarah. And it's just to say, we'll do a proper goodbye at the end. But to just thank you so much, Zara, for joining me today in this conversation. I've really enjoyed talking this through, and I think we'll have a great discussion now. So I'll hand back to you, Sarah.
Thanks so much to both of you. That was really fascinating, and actually, I think brings up a lot of the kind of procedural issues that we all face when we're trying to do properly engaged. There's a distinction, I think, that maybe it might be worth us talking about between public engagement and engaged research. And I think that's one of the things that kind of maybe we need to do a bit of clarification on, because when we talk about whether or not it's appropriate for research ethics committees to kind of make you jump through these hoops, even if we're not collecting data from participants, as we've kind of demonstrated today, it's very clear that these experiences that you have as researchers then feeds back into your research. So I think that's kind of one of the things that we need to think about. And I think it's really notable that one of the main public engagement journals, Research for All, you can't publish in that unless you actually show them the ethics approval. And a lot of the funders kind of understandably expect an ethics approval approach. So I'm going to abuse my kind of position as chair here to kind of actually just ask that question. So if we know that we kind of do have to do some kind of ethics process, and we know that the current kind of forms and questions that we go through aren't really fit for purpose for this kind of work, what is it that you would want that process to look like in order to kind of really facilitate the kind of work that we're trying to do here?
I don't mind jumping in to say, I had a really positive experience working on this, as you would know, Sarah, because we had a lot of back and forth on this. And I honestly don't think that much has to change. I mean, I think partly it's a small thing around just having a separate set of forms, because there is part of just the banal labor of it is, the questions explain your research study, and having to have a heading sentence that says this isn't a research study. Because I think the sort of substance of the ethics approval process, which is about, I think, safeguarding the people we're working with, all of that substance is the same. In principle, we're trying to do the same thing, make sure that when we're working with people, whether we're explicitly collecting data or not, we're doing it in a way that acknowledges that we're in a position of power and privilege, that we are going to take some things away from this, even if it isn't an explicit, like creating a data set and writing a journal article. We are taking something out of this. So I think the kind of principle of it is the same, and it may just be something as simple as having a different set of forms. And I think one thing to say on it, because I think more and more people do want to, in addition to the requirement, I think more and more people do want to do this process and want to have support about how to do it well. I think one of the things that it really pushes you to think about is, even outside of the ethics, to just really like drill down and be clear about what are we doing, why are we doing it, how are we doing it, what's going to be the outcome. And I think, as you say, if someone is doing engaged research, that's probably built in more because it's not a different kind of, it's like a type of research, but it's still in the research wheelhouse. Whereas I think mindset wise, if you think, well, I'm not really doing research, I'm doing public engagement, you kind of like can switch gears in the way you're approaching what you're doing. And I think having an ethics approval process kind of takes people back in terms of saying, we need to be like thoughtful and reflective about what we're doing it and how we're doing it and what the outcomes are going to be. So yeah, that's not a really full answer. I think a lot of it might just be just sort of actually having a separate bit of paperwork, a separate bit of questions, and maybe a separate bit of like training for people to kind of remind people, yes, even though it's not research, we still kind of want you to take a research integrity mindset into this work that you're doing.
Thanks, that's really helpful. Zara, is there anything that you'd like to say on that question?
I don't think so. I think Rhea's covered it pretty well. But yeah, I think I do understand the point of ethics, of course, is to, overlook such projects and maybe also highlight things that us as coordinators putting together the project have maybe not looked at or considered. So I do know that I do think it's a helpful process, but I also think that it shouldn't be a barrier when it comes to doing public engagement projects.